All right, there you go.
Good to go? Okay. So hi, everyone. My name is Chelsie Carter. I work for Platte County Health Department, and I am here to kind of explain what the health department does. Because if you are like me, before I started working here, I thought the health department was only for flu shots and maybe pregnancy tests and things like that. But there's just so many different services that we have to offer at the health department. And I know that COVID is obviously a hot topic, and I'm here to say we live and breathe COVID every day, and it is great time at the health department. But first, I wanted to kind of explain the different departments that we have, just so we can kind of show you what all we have to offer. And then also I will briefly talk about COVID in the sense of what all we are doing behind the scenes that the community might not know of. So first, one of the big things that we are known for, especially here in Parkville, is our Parkville clinic that we have off of East Street, right in front of the nature sanctuary. So we're neighbors. And so we have 3 different clinics in that building, which is kind of a small building. So we try and make it work. The first clinic is our Women, Infant, and Children clinic, which is what we call also WIC. So WIC is for women and infants and children who are in need and need help reaching like nutritional needs. So they help making sure that the kiddos and the moms get the proper nutrition and the good foods that they need to be healthy and happy. And then, so that is one clinic that we have. And if you need or know anyone that needs that service, you can go online to our website and find out more. And then there is another clinic that we have on site that is called the Public Clinic Services, something along those lines. We change it every time, but we used to call it a walk-in clinic. Now, obviously with COVID, nothing's walk-in anymore. So we have appointment based, but for that one, that is more of our traditional public health type clinic. So we offer immunizations there for school, flu shots, shingles shots, pneumonia shots, anything like that we have available. And then we also provide pregnancy tests and sexually transmitted diseases tests as well. And we offer free blood pressure screenings in that clinic as well. So again, another clinic in the Parkville office that we have. And then we also have another clinic. It's very confusing, and we try our best, me and Natalie, to explain this. But our third clinic that we have is our family healthcare clinic. So we explain this as just like your normal doctor's office. So we do have a nurse practitioner on staff that sees patients throughout the week. And then we also have a doctor on staff that comes in 2 times a month to help patients who need specific medications and things like that. So this clinic is mostly for people who are uninsured and or on state insurance, so Medicaid. And so that is a way that we can help those people as well. And for our clinics, we serve not only Platte, but we also serve Clay and then parts of Jackson as well. So that is kind of the gist of what we have in Parkville. Now, in regards to COVID, because I know that's a hot button issue, and I know everyone has questions about immunizations, which we'll get to that. But for COVID, we have kind of taken it as a team approach at the health department. So our epidemiologist, bless her heart, she's doing absolutely the best that she can with everything going on and all the meetings and things like that. So she is a part of the case investigation team, and she heads that and makes sure everyone is accounted for. And if there is any questions regarding data or anything like that, she will definitely hop on that and help us out. Before, her job looked more like TB cases, flu cases, dog bites, things like that. But now with COVID, she is very busy and working long hours. So we do everything we can to help her and make sure that we're kind of trying to divvy up the work as much as we can. Now, for my department, before I was in the community a lot as a community development specialist. I would go to meetings and make sure that different organizations and people had the things that they needed, the resources they needed, and if there was any way that we could help, we would offer our assistance. Now, with COVID, I'm not in the community as much, and I'm actually helping with the scheduling for COVID testing and COVID vaccines as well. And so that kind of just shows that as a health department, we are wearing a lot of different hats, all of us. So what we were doing before COVID is obviously not the same. And then we also have another department, our environmental health specialists, who typically are responsible for doing sanitation checks for restaurants, sewage inspections, things like that. They are still doing that. So the restaurants are still safe to go to in Platte County, but they are also taking on the consumer complaints that if a business is not requiring masks or they're not having the proper PPE or anything like that, then they will go and have a nice talk with them and educate them on why it's important for us to be wearing our masks. So, which I won't bore you with because I'm sure everyone knows. And that's the last thing people want to hear from the health department. And then they have also been helping with calls and just overall communication with the public on coronavirus and what we can do to help ease the spread. So, Natalie is here to kind of help me, first off, stay in line because sometimes I go on tangents. And second off, if anything I miss, she would also help. So Natalie, am I okay to talk about immunizations in our process? Okay. Okay, so for immunizations, we do currently have vaccine in stock. However, we are doing healthcare providers first is our first priority. We only have 200 doses on site at this time. And the state of Missouri is doing their best to allocate the vaccine to the counties that need it the most. So we're doing, I think our numbers are pretty good and they're going down, but we're still needing the vaccine just like everyone else. So when people do give us a call and they say, why don't we have any vaccine? We always say we're ready for it. We're just waiting for them to send us what we need to get it going. But we have started immunizing the healthcare workers in Platte County. We are still working on them. We will move to 1B, which is the older population, so 65 and up, and then people with previous medical conditions. So be on the lookout for that. Again, as of right now, we don't know when we are getting our vaccine in. We have put in an order for it. It's just up to the state of Missouri to give us what they think that we need in order to start the process. Am I missing anything? Am I missing anything? I felt like I talked very quickly.
Well, that's okay. I'll put the question and answer section.
Perfect. I'm better at that, so that's great.